So today we are going to talk about clerking because clerking is one important thing where doctors have to do it perfectly so that you have to train it from the beginning, like from your internship. So you're watching the Medical Forum, and this is Dr. Ishfaq. I am a registrar of medicine in National Hospital Kandy. So about clerking. Now, why I decided to talk about clerking is because I've seen various medical officers in uh, my time of work, and there are people who clerk really well. There are people who identify problems, but there are still some people which I'm shocked that their clerking ability is so poor that they can't come up with new problems. They can't maintain a dynamic problem list. So on and so forth. So that is why clerking is very important. So let me just give you a brief overview of how do you start clerking, right? So for instance, let's say this is not the first time you're clerking the patient. Let's say this patient has already been there in the ward and you are doing the rounds or something like that. So first of all, I'm Dr. Ishfaq, right? So you need to write your name, okay, and your designation, and then you need to write the time, 8 a.m., and then you need to definitely start with your date, okay, 11th of June, right? So this is the first thing you do, right? This is the first thing you do. Next, let's say you always start with the age, right? Let's say this is a 34-year-old, okay? So first of all, list down the problems she's already been diagnosed with. So you know in a background what's going on in this patient. So let's say this patient is with SLE. Now just don't write SLE, just find out, go through her records, ask the patient, what are the complications this patient has had with SLE, right? So there could be a hematological manifestation like an autoimmune hemolytic anemia, right? There could also be a renal element. So a renal element like lupus nephritis. So if there is lupus nephritis, whether class 3 or class 4 or class 5, right? And has she or he been on cyclophosphamide? What are the drugs she's on? And then most importantly, where is she being followed up at? Is she being followed up at the hospital where she's admitted right now? Is she being followed up at the local hospital? Or does she have a follow-up at all? No, those sort of things you have to determine here. Then what you can do is you can come with something like admitted with. Now the next day morning you don't have to write everything again, just you can write briefly to just remind you why she came. She got admitted with fever and seizures, right? So currently now, from yesterday till now, there would have been some progress, no? So the patient obviously is being managed for something. Now what is she being managed for at the moment? So that is called your working diagnosis. Working diagnosis. So let's say because she came with fever and seizures, this patient is being managed for a meningoencephalitis. Okay, she has been started on ceftriaxone 2 grams BD, right? So now when it is a patient who's coming with seizures in a patient who has SLE, there are 5 DDs. Yeah, you need to have your DDs prepared. So this could be TB meningitis. This could be a bacterial meningitis. This could be a cerebral lupus. Okay? This could be a cerebral venous sinus thrombosis, and this could be even a uremic NCAF, because the patient can have renal complications due to that. They can go into, so all these should be thought about when a patient is coming with seizures, right? Then you have to develop like what is being done so far. So an NCCT brain has been done. Okay, you can write whether it is normal or not, or preparing for MRI. Right. So that is the current status of the patient. Then what you have to do? Then you have to do something called, you need to ask how is she feeling right now. Okay, so now what is her complaints? How does she feel now? How does she feel now? So once you analyze those complaints, you can see if she has been responding to this or not, right? Then what do? Then you go for your examination, whether she's febrile or not, whether there is an element of pallor, whether she's icteric or not, right? Then you go for her respiratory system. Just briefly mention what is it, clear or are there creps, right? And what about the heart sounds? Is it dual rhythm or are there murmurs? If there is a murmur, should you think about infective endocarditis, right? And then go to the abdomen. See if the abdomen is soft or not, if there is tenderness. If there is tenderness, there can be element of portal venous thrombosis, right? Portal vein thrombosis. Then go for the legs if there is edema, skin for any rashes. Okay, so then what do? Now you've examined, then what you do is you just go for the investigations what you have now, like what is happening with the full blood count, just in brief. You don't have to copy the whole report, just briefly. What is happening with the full blood count? What is happening with the CRP? What is happening with the renal functions? Have we done an ESR in this case? To have we done a C3 C4, because we don't know if this is a SLE flare up or not, right? So what happens in regards with the investigations? Then finally you come with the plan. So plan is always having two arms. One thing, plan what investigations you will do further, then what management you will do further. So if you are adding a management, you need to add it here, whether it is a drug, whether it is a procedure, or whether is it a referral, or whether it is to get a senior opinion, you write it here. So this is how you do a clocking. So from the patient's age to the past medical history and to why she was admitted and what's the working diagnosis right now, what has been done so far to exclude the DDs, and then go for examination. Before that, you ask how she feels right now, so that you know if this is if she's responding to your treatment, and go for examination. And in examination, you detect new things. When you detect new things, you can add more problems. Like if you want, you can add more problems, 2 or 3 likewise. Then what is happening with the investigations you already have? Then finally you come with a plan, and that plan always uh, have two arms. One is investigations, one is management. You have to plan your investigations, you have to plan your management, right? So this management could be adding a drug, omitting a drug, changing the dose of the drug, referring to someone, asking a senior opinion, all this. So clocking is very important, and I hope this short video helps you. Will bring you more tips and more informative short clips in how to improve your skills in being a great clinician, starting from your internship. Thanks for watching, guys.